Hi everyone, my name is Dr. Trish Harkins from Dublin, Ireland, and I'm reporting for Room Now from ACR 2022. Today I have the absolute honour and privilege to be joined by Professor Lihi Eder, who needs no introduction. As many of you know, she is a professor, rheumatologist and scientist at Women's College Hospital and the University of Toronto. So today, Professor Eder has very kindly agreed to discuss her abstract number 1007 entitled Metabolic Disorders and Abnormal Dietary Patterns and the Association with Psoriatic Arthritis. So the DIPSA study, the Dietary Interventions in Psoriatic Arthritis. So first off, thank you so much, Professor Eder, for agreeing to join us today. My first question is, what inspired you to undertake this research?
Thank you, Trish. This is, I guess, a good question. And we know that psoriatic arthritis is strongly associated with obesity. Many of the patients that we see in the clinic are facing obesity and its related metabolic abnormalities. And so there is more and more epidemiologic data to suggest that obesity is actually a risk factor for development of psoriatic arthritis, and it's also associated with poor disease outcomes. And there are also some studies that suggest that some dietary habits or changes, especially in mice models, could be associated with development of psoriasis itself. So we were wondering whether, well, we see patients that are seeing me, I'm sure the patients that you see in the clinic as well are asking about what they should eat or what they shouldn't eat in order to make their disease better. And so we decided to study that. And our hypothesis was that we believe that losing weight is important. There are some data, mostly in psoriasis patients, that losing weight could improve, at least to a mild to moderate degree, their psoriasis. There is not much in psoriatic arthritis, but that's some data to suggest that. But the problem with losing weight is that it's really hard to achieve and maintain. So we were also asking ourselves whether focusing on healthy diet habits would be another way of improving patient outcomes beyond just weight loss. And that's why we selected Mediterranean diet, which is a type of diet that's associated with many good outcomes. And yes, it might be associated with some weight loss, but more focusing on the olive oil and nuts and fruits and vegetables, these components, rather than focusing on losing weight. So this is really the hypothesis behind the DIPSA study, which is a randomized control trial aimed at assessing whether a Mediterranean diet versus low-caloric diet versus standard of care could be used as an adjunct therapy, not instead of therapy, but adjunct therapy in patients who continue to have ongoing symptoms related to PsA.
Brilliant. And I know this is incredibly complex, but I was just wondering if you could briefly give us your opinion on what you think is driving the link of obesity with psoriatic arthritis.
Yeah, there are several hypotheses, and one, we all know that obesity is a state of, it's a pro-inflammatory state, so the adipose tissue is not just this source of energy, but it can function as an endocrine organ. There is production of pro-inflammatory cytokines, so it's possible that this pro-inflammatory milieu would affect the skin and the joints. That's one hypothesis. And there are some other hypotheses related to the biomechanical stress associated with obesity influencing the enthesis. And then there are some hypotheses around the microbiome. Maybe things that we eat would affect the microbiome. In the DIPSA study, we do collect stool samples and blood samples, so we will be able to test some of these hypotheses in the future.
So watch this space.
Yes.
So back to your abstract, if you could briefly go through the methodology and maybe some of the pertinent results from abstract 1007.
So this is really, DIPSA is an ongoing study, and we are still recruiting, but we thought it might be kind of helpful to start looking at the data from the first 32 patients that were recruited. We aim to recruit a total of 90 patients. So we were assessing first their sort of metabolic abnormalities, and as expected, because patients that are recruited for DIPSA are those that have overweight and at least overweight. So many of over 70% of the patients were obese, and as expected as well, they had a lot of metabolic abnormalities such as hypertension, dyslipidemia. This was not a surprise. The other component of the study was asking patients about their dietary habits. So when they enroll in the study, they complete a dietary recall for 3 weekdays. And then there is a way to estimate how good they adhere with recommended diet. This is based on the American Nutrition Association, and it's called the Healthy Eating Index. So there are several categories for different food components, and based on this recall, we give them a score ranging from 0 to 10 or 0 to 5, and the higher the score, the better they are in terms of adhering with these recommended diets. We found that there was the low adherence in terms of the different food components was with whole grains and sodium. So these were the components that people received the lowest scores. Women were generally doing better than men, maybe more conscious about what they eat.
Yeah.
And then the last component was we assessed the correlation between this index of adherence index and some measures of disease activity in PsA. We did find some interesting associations there. We found that people that consume more fruits had less swollen joints. People that were consuming less sugars had lower fatigue and lower PsA, which is a measure of quality of life. And there was also some association with unsaturated and saturated fatty acids and enthesitis. So this is very preliminary. Obviously, it's a cross-sectional analysis, but it does show some interesting associations that would hopefully be confirmed in the randomized control trial itself. And we hope that we'll be able to determine whether diets could actually be used as an adjunct therapy in psoriatic arthritis in those patients that don't meet the low disease activity state, just as an add-on. Again, it's not replacing any of the very effective medications that we have, but just as an add-on that could potentially improve the psoriatic arthritis as well as their metabolic abnormalities.
Which is brilliant. I suppose, and following on from that and the next steps of the study, what do you ultimately hope the impact of your results will have on the lives of patients with psoriatic arthritis?
Well, I believe there are still lots of gaps, despite the fact that in psoriatic arthritis there has been huge advances in therapy. We have lots of modes of actions and biologics and targeted synthetic therapies. Many patients are still facing a high burden of disease. Some of it may not be improved just by targeting the immune cells or immune pathways. There are some other aspects of related to comorbidities that we need to address. Their cardiovascular health is a major part of their disease. So, and also diet is really something that people are asking about it. Many people are keen to try, and if it can make their disease better, that would be a great bonus.
Absolutely. And even quality of life, simple, easily modifiable things to change in their diet. Yeah. So thank you so much. I'm really excited for the next stage of the study and hearing the results for that. Thank you so much again for joining us today. And thank you to everyone who listened in. I encourage you all to subscribe to Room Now and follow us all on Twitter to keep up to date with all things ACR 2022.